Hello and welcome to this poster presentation entitled Cannabis Use and Mental Health Among Sexual and Gender Minority Men. Now I'm just on pot and I feel great. This poster is being presented by myself, Natasha, in collaboration with PJ Kulu, Muhammad Amory, and Rod Knight. A bit of background about this work. Despite evidence indicating an association between cannabis use and mental health conditions among sexual and gender minority men, there is a dearth of research exploring how young SGM men's use of cannabis relates to their experiences with mental health. Drawing on interviews with 50 SGM men ages 15 to 30 years old in Vancouver, we employed a constant comparative thematic analysis about young SGM men's experiences of using cannabis and how it relates to their mental health. As you can see in the top right corner of this poster, we have some information about our participants' characteristics. The average age of participants in this study was 24 years old, and as you can see by these two circular graphs, their gender identities and sexual orientations were quite diverse. Our analysis revealed three major themes. The first was cannabis to cope with mental health. Many participants described how cannabis was used to manage or cope with symptoms of mental health, and several pointed out that this was particularly important given stressors that they had experienced as young SGM men. For example, Augustus said, "I use marijuana quite frequently because it helps with self-diagnosis, it helps with my anxiety. Nobody told me to use it, but personally, it helps with my anxiety." The second theme was cannabis to cope with mental health during sex. Several participants explained how using cannabis permitted them to more fully enjoy their sexuality, including enhancing pleasure by distracting them from feelings of anxiety, such as performance anxiety, social anxiety, or anxiety related to experiences of past trauma. For example, Lee said, "The last time I got really high was the first guy I'd been with since my rape with my ex. And it was just like there was a lot of trauma living in my body. I just needed to not be in the headspace or the physical space that I was used to inhabiting." The third theme was adverse effects of using cannabis. A subset of participants raised adverse effects of cannabis use on mental health, such as concerns around cannabis use as a superficial means of coping, as well as concerns around cannabis dependence. For example, Milos said, "I've definitely known people who start off using it, cannabis, like that, to cope with symptoms of mental health, and they kind of rely on it a little bit too much. And I've, of course, gone through the phases where I worried about myself if I was like, am I unconsciously using these to self-medicate?" In conclusion, our findings reveal how cannabis can be used to manage or decrease experiences of mental health among SGM men, while emphasizing how SGM men's cannabis use is embedded within social and structural conditions that can produce negative mental health outcomes. This work underscores the need for interventions that can attend to the unjust social conditions that perpetrate stigma, prejudice, and discrimination for those who do not embody hetero and cis-normative identities, as well as the need for harm reduction resources for those experiencing mental health-related harms from using cannabis. We wish to thank the study participants for their contribution to this research, as well as current and past researchers and staff. If you have any questions about this work, please feel free to contact me. My email is listed at the bottom of this poster. Thank you.